Diabetes is a common and chronic health condition which impacts the way your body converts food to energy. After food consumption, your body converts that food to sugar or glucose, then it enters into your bloodstream. As your sugar level rises, then your pancreas is stimulated to produce insulin, which is a hormone which lowers the blood sugar level. Insulin also allows glucose to enter your cells and be utilized as energy. When a person is diabetic, two things happen in their body. As a result, when there is an insufficient insulin or the cells are resistant to insulin, in this way, the glucose remains in bloodstream and it raises the level of blood sugar. Now, you can understand what is the mechanism behind high level of blood sugar in diabetic patients in their blood tests. Mainly, three types of diabetes are defined. In type 1 diabetes, your body attacks its cells and prevents them from producing insulin. It's typically diagnosed in young people like children, teenagers, or young adults. And symptoms of type 1 diabetes can come up very suddenly. And the current treatments for this type of diabetes is daily insulin intake. But in type 2 diabetes, your body cannot use insulin effectively, although insulin is produced by pancreas. And this is the most common type of diabetes. It usually develops over time, usually occurs in adults, but the age for this type of diabetes is also decreasing, and even it is seen in young adults. The third type is gestational diabetes. It develops pregnant women who didn't have diabetes before. That was a short summary of the types of diabetes. As I said, age for diabetes is decreasing, so we can also expect type 2 diabetes in young adults. There are times that diabetes, especially in young people, is underdiagnosed or diagnosed at a later time when some other complications have occurred. So we must be careful about the signs like dermatologic signs. When diabetes affects your skin, it means that the level of your blood sugar has been high over time, or sometimes some of these dermatologic signs appear even before you're diagnosed with diabetes. In this video, we will review some of the common dermatologic presentation of diabetes. The first one is acanthosis nigricans. This skin condition causes a dark patch or band of velvety skin that can appear in body creases such as your neck, armpits, or groin. Sometimes the patches can also appear on your hands, elbows, or knees. Acanthosis nigricans is a sign of insulin resistance and can also be the sign of prediabetes, diabetes type 2. It is also very common in people with obesity. The best way to manage acanthosis nigricans: lifestyle modification. For example, having a healthy diet, weight loss, and having regular physical activity. In patients who are diabetic and take metformin, besides glycemic control, acanthosis nigricans can also be controlled because metformin also reduces insulin resistance. The second one is diabetic dermopathy. This condition is also known as shin spots and is harmless. The spots look like red or brown round patches or lines in the skin and are common in people with diabetes. They appear on the front of your legs and are often confused with age spots. The spots don't hurt, itch, or open up. Diabetic dermopathy occurs because diabetes usually makes some changes to small blood vessels that reduce blood supply. Even though diabetic dermopathy might occur before diabetes is diagnosed, it's more common as a later complication of diabetes. Because of its asymptomatic nature, the treatment is usually avoided, but patients should be closely monitored and examined for other complications of high levels of blood sugar. One of the most important dermatologic presentation of diabetes is diabetic foot syndrome. Diabetic foot syndrome refers to nerve and blood vessel problems that can happen in the feet of people with diabetes, even though it can be prevented, but it is also a major cause of illness, death and hospitalization, and diminished quality of life in people with diabetes. It seems that this syndrome happens more in people who have been diagnosed with diabetes for a while. But there are times people present with this syndrome while they do not know they are diabetic. For example, their foot is wounded, but this wound has not been healed, or it has taken a longer time than normal to heal. And this indicates the damage that high blood glucose has done to the nerves and blood vessels of the feet, and it has decreased the body's capability to repair itself. One of the common dermatologic problems with diabetic patients are dry and itchy skin. You might have seen diabetic people just trying to scratch their skin and they complain about their dry skin. It also happens in other people as well. This is also a common sign in diabetic patients. But what causes that dry skin in diabetic patients? Too much sugar in the blood causes the body to pull fluid from its cells so that it can produce enough urine to remove the excess sugar. This can make your skin dry. But what can be done about it? First of all, the blood sugar must be monitored and it should be kept at the target range as much as possible. But there are also some other tips that you can follow in order to make it less hurts. For example, you can limit your time in the shower, or you can lose lotion after taking shower. Another presentation can be bacterial infection. Of course, anyone can get bacterial infection, but in diabetic patients, it is recurrence, because when there's too much sugar in the blood, the bacteria can thrive. After getting bacterial infection, you might notice a part of your tissue has become inflamed, hot, red, or painful. Bacterial infections can be treated with antibiotics. They can be used topical, oral, or even intravenous, depending on the extent of your infection and how serious it is. But again, the best measure is having a healthy life and keeping your blood sugar at a target level. Another recurrent infection that diabetic people might face are fungal infections. Fungal infections create itchy rashes surrounded by tiny red blisters and scales. They usually develop in warm and moist folds of the skin. Again, keeping your blood sugar at a target level is the best way to prevent from recurrent fungal infection. Another dermatologic presentation, especially in diabetes type 1, is digital sclerosis. It starts with tight, thick, and waxy skin on your fingers and can cause your finger to become stiff and hard to move. If blood sugar levels remain high, digital sclerosis can cause your skin to become harder and thicker, and it can also spread throughout your body. And what can be done about digital sclerosis? And again, bringing your blood sugar level low is the best way to control digital sclerosis, and sometimes physiotherapy is needed in order to increase the range of motions in your affected joints. I only talked about common skin problems in diabetes. These might also be seen in other disorders or even in normal people. So, this information is not supposed to cause undue concern for you. You should just be more aware about your health conditions and time to time get checked by your doctor. Apart from these common presentations, there are also some other rare dermatologic presentations in diabetic patients that might also be seen in other disorders as well. So, it sometimes gets really complicated to diagnose the underlying disease. That's why you need to consult with a healthcare professional for an accurate diagnosis. Hope this video has been informative for you. Please like it and comment if you have any questions or suggestions, and subscribe my channel for more videos.